Hi, everyone on Facebook. We are getting started in just a moment. All right. Welcome, everybody. Tonight, I am Stephanie Coleman. I'm with Kansas LEND. I'm the Autism Family Educator here at Kansas LEND. LEND stands for Leadership Education and Neurodevelopmental and Related Disabilities. We are housed at the University of Kansas Medical Center. I also happen to be fortunate enough to be a part of the grant that supports the Kansas Family Support Center. So I'm kind of in a dual role, but I'm really excited tonight to share that we have two individuals, Kelly Cluthy and Raneem Akila from the Kansas Family Support Center, coming to talk to us about the new support center for families across the state of Kansas. So they're going to talk about the supports and resources that we offer families. The Kansas Family Support Center is located within the Kansas Center for Autism Research and Training at the University of Kansas Medical Center. Some of you may have heard of KCART in the past. That's the Kansas Center for Autism Research and Training. So we're glad you are here. Thanks for joining us. And now I am going to turn it over to Raneem.
Hello, everyone. Thank you so much. Thank you so much, Stephanie, for introducing us. My name is Raneem. I am a research assistant at the Kansas Family Support Center. Today we
I'm
will
sorry.
have,
Whoops, Raneem, sorry. I did forget to hit record. So I'm going to hit record right now. And then if you'll start over again, that would be great.
no worries.
Okay. Sorry about that.
Oh, you're all good. Okay. Thank you, everyone. So my name is Raneem. I am a research assistant at the Kansas Family Support Center. Today, this evening, we will be discussing sort of a two-in-one presentation. I will go over our newly funded KFSC program, and my coworker Kelly will go over OASIS. So today, we will discuss support and resources for families. And as Stephanie has mentioned, that we are housed at the Kansas Center for, the Kansas University of Kansas Medical Center. I apologize. So let's get started. Um, Kansas Family Support Center serves children with autism and other intellectual and developmental disabilities. We are housed within KCART, or the Kansas Center for Autism Research and Training. KFSC was just recently funded 3 grants. We have the Kansas Department for Children and Families, Kansas Department for Aging and Disability Services, and the Cigna Foundation. So 2 of our grants are more foster focused, and then one of our grants is more general population focused, and I will go into more detail as more slides come up. So our target audience. We have birth and foster families of children with autism and intellectual and developmental disabilities, families and caregivers, including extended family members living with a child with a disability in Kansas who qualify for waiver services. This includes those who require assistive services, personal care services, telehealth, and respite or foster care. And we have the professional support personnel who work with our target audience. So in terms of target audience, I like to think of it as 2 separate categories. As I've mentioned, we have 2 grants that focus on foster population and 1 grant that's more general. So the more general population is not just doesn't just focus on our autism individuals and is not just foster specific. It incorporates a wider range of individuals, and we're able to incorporate professionals with different backgrounds that are able to discuss different topics because it incorporates different behavioral health needs. However, our 2 other grants, they focus on foster specific and autism specific individuals, and so that's how we have the target audience that would all fall under that category, but then I like to classify it as, okay, we have foster and autism specific or subpopulation B, which is not autism specific and more general. So our primary mission is to build a tiered level of support to educate, establish relationships, and identify resources for our target audience through webinars and echoes, which I will talk more about in a minute. Referral services. training for direct service providers, and individualized training services for families and caregivers of children in foster care. So, in terms of our mission, we also work on implementing a comprehensive caregiver support system that is designed to address the following: engagement, establish state and community partnerships to build capacity to support the target population; learning community, develop sustainable support community across child and family serving systems; family navigation, support biological and foster families and at-risk youth for in or out-of-home placement and navigating across support system. And then services, provide tiered support to provide education and training for the target population. And then workforce is where professional or like personnel individuals, professional personnel who work with our target audience. They advance interdisciplinary practices in workforce development to increase family preservation and reunification. So I also, like, in terms of primary program mission, I think of spreading knowledge and awareness to the Kansas City metro and beyond. We utilize surveys to like to record data to ensure that our target audience has gained knowledge about the topic that's being discussed, because this is also like a research study housed within our program. And then we also focus, like we've also noticed that we've reached other counties in Kansas where evidence-based studies have shown that there's a social disparity and they haven't had many services and they haven't had like the knowledge and information known to them that these services are available to them. So like that's how I view the program's mission as well, is to just spread knowledge and awareness in the Kansas City metro and beyond about the services that we offer and what's available to our target population. So our activities, we have tier 1, which is primary education. It's echo and webinars. So as I've mentioned, I'll discuss this in detail. Echoes are targeting professionals in the field who work with our target population. And then webinars are families and caregivers, like family and caregiver series. So echoes typically consist of like a professional who would like to share or like explain their expertise to another professional who would like to then implement and practice that knowledge within their field. Or webinar series where it could be another parent or individual who has gone through something similar and they can relate to a family member or another individual who has experienced something similar. And then tier 2, which is secondary support, we have OASIS direct service provider training and child-adult relationship enhancement or care workshops. And we have tier 3, which is the more individualized treatment. We have OASIS parent training, parent-child interaction therapy. We have referral services and individual consultations. My coworker Kelly will explain more or talk more about tier 2 and tier 3. So duration of activities, we host monthly webinars and echoes. So as I've said earlier, we have like population A and population B, or like subpopulation A and subpopulation B. So for grants that are focusing more on foster specific and autism specific populations, they have one echo and one webinar per month. And then we have another webinar and another echo that focuses more on individuals that are not, it could be any behavioral need, or it could be not foster specific. So in total, we have two echoes and 2 webinars, 4 total events a month that targets the umbrella of our like population, our target population. We also have ongoing partnerships with foster agencies. And then tier 2, we have ongoing network foster agencies and behavioral pediatrics professional support for birth and foster families of children with ASD and IDD, and quarterly agency level direct service provider DSP training. And then our most like specialized like most personal Tier 3 program activities. We have ongoing OASIS parent training services, which typically take about 4 to 6 months to complete the curriculum, and we have ongoing consultations offered as well, and ongoing referrals to our network of providers. So this is another diagram that I just put together in an effort of, I know I just said a lot of information, so hopefully this simplifies everything. So tier 1, which is echoes and webinars, more general, anybody can join, depends if they're a professional or if they're a caregiver, and it's just online, virtual, an hour-long session. And then we have tier 2, which is referral services and trainings, and then tier 3, which is individualized support. So this will just go over echoes again. Webinars, echoes and webinars. Webinars are focused towards birth and foster families and caregivers. Topics discussed are relevant to caregivers. We have some example topics that we've presented on previously, including but not limited to attachment styles and communication, navigating IEPs in schools, and basics of behavior and building rapport. And then we have echoes, which are focused towards relevant professionals who interact with the target audience. Examples of professionals who participate in these echoes could be case managers, school mental health staff, psychologists, teachers, and more. These echoes are typically 40 minutes long with a case presentation at the end. And example echoes that we've had in the past include trends in autism spectrum disorder, healthy contingencies, consequence management strategies, and psychological first aid. So in case you were wondering what a case presentation is within an echo, so they're used to promote audience engagement with the guide of a professional. Audience members propose solutions to the case presented alongside the presenter. So they're typically like a slide, and then it's just a case presented to the audience, and the audience members will engage and propose a solution alongside the presenter's guided expertise about how to tackle that case. I've also attached a sample case presentation that we typically include. So it could be a 4-year-old in preschool, just some basic information of what is going on, what the situation is, what their name is. This is all not real, so just a heads up. But this is just a sample case presentation of what we would have in our echoes. And then the audience members would try to figure out a plan of how to resolve this issue, or what plan to implement alongside the presenter's expertise. So who are the trainers? We have KCAR and OASIS coaches. KCAR and OASIS coaches will provide OASIS parent trainings. And then we have behavioral, pediatrics, and other relevant professionals who will contribute to webinars and echoes. And then we have certified personnel who will be responsible for facilitating any additional trainings hosted by our community partners. An example would be PCIT or CARE, and then more to be discussed soon. So benefits of our program. It's a centralized statewide hub of resources to increase a variety of services, mental and/or behavioral health support. It increases the ability of family caregivers to provide a safe and supportive environment for children, helps family caregivers identify and use healthy coping strategies to decrease caregiver strain, and enhances the family caregiver strategies for the child's symptom and behavior management. We also have improved continuity of care and support from a multidisciplinary network of services. We provide foster parents access to disability-specific resources and training, and we decrease multiple placements for children with autism spectrum disorder or IDD within the foster system. Again, I think a great benefit that I've seen from this program is that a lot of families don't know the resources that are available to them. And so through this program, they're able to identify which resources they may potentially qualify for, which I think is great. And then increase family reunification. So our expected program outcomes. We increase family caregiver knowledge of indicators and impacts on behavior management, increase the number of family caregivers attending educational and ECHO series and their knowledge of evidence-based behavior management strategies, and increase the percentage of children with at risk for out-of-home placement receiving provider referrals for screenings and intervention services. We increase the number of families with access to behavior management support services and decrease caregiver perception of the need for out-of-home placement or placement change requests for children in foster care, and increase the number of families receiving intensive support and behavior management services by project staff and community engagement partners. So that's it for part one. That was the Kansas Family Support Center, just an overview of what we offer. And I will pass it over to Kelly, my coworker, who will go into more depth over our OASIS training.
Good evening, everyone. I'm Kelly Cluthy, and like Reneem said, I work with her on our KFSC project, and I'll be going over some of the trainings that she mentioned that fall underneath our OASIS umbrella. OASIS is a series of trainings that we offer for both caregivers and professionals. These trainings are based on evidence that is support for basically ABA, or applied behavior analysis, is currently the most effective treatment for children with autism, and these trainings use skills and knowledge from ABA to support children with with like autism and other intellectual and developmental disabilities. For ABA to be effective, these programs and treatment plans need to be implemented with high fidelity. And we are not the only training program that uses ABA as its model. It's a pretty common thing that you see in different program offerings. Access to ABA services, however, remains a challenge for a lot of families. In urban areas, we tend to see very long wait lists, with families sometimes waiting months or years, in some cases, for treatment. And people that live in more rural areas often lack access to providers. So OASIS comes in to basically help fill in the gaps that these families experience while waiting for full-time services. We offer a suite of training programs that focus on both caregivers and service providers, and they teach both ABA to basically how to use ABA with children with autism and other neurodevelopmental disorders. OASIS is designed to increase family access to evidence-based practices and helps support some of those families who may not otherwise have access. Basically, a training session with our family model is an online series of tutorials where parents can navigate through and learn general information and concepts related to intervention or treatment protocols. And these online tutorials are then followed with either an in-person or telehealth session with an OASIS coach. During the time with the coach, the parents will work with the coach to practice the techniques that they learned in the online tutorials while receiving real-time guidance and feedback. OASIS training is also supports billing through insurance. OASIS parent training comes from funding from the National Institute on Disability, Independent Living, and Rehabilitation Research, or NIDLR. And it's based off of another training that we offer for direct service providers. But a few years ago, we actually noticed that parents were signing up for this training and trying to use it at home. It's a pretty popular training model that teaches ABA to providers that serve children with autism, and it has been adopted by multiple state agencies as a required training for credentialing. During OASIS parent training, parents learn information about the best practices and evidence-based approaches. They also learn how to support and promote independence in their children, teach appropriate replacement skills for problem behaviors. We also teach strategies to advance social and academic skills, how to generalize new skills and maintain those skills over time. We also help implement effective methods of play. And we also help families access services at both the local and state levels, like Reneem has mentioned. So this Oasis parent training comes in a couple of different flavors. We can offer it both fully online, a hybrid model, or with in-person delivery. Families will work with their coach to determine what works best for them. We do have a fully online model as well without coach oversight that is available. So we do have some families that just really can't schedule that 1 hour time a week with the coach, and this is a good option for them. The parent training has 16 online modules where the parents will complete a tutorial over these skills and knowledge based on ABA. They'll take a quiz to go over and see how well you retain that information. And then there's also a place for recording some behaviors that you may notice or encounter throughout the week and between the sessions with your coach. Typically, parent training lasts 12 to 24 weeks, depending on scheduling. We do have a Spanish version that is in progress that we're hoping to be able to offer later this year. And basically, during the coaching sessions, parents are going to practice implementing ABA skills with their own child and get that immediate feedback from the coach until mastery is reached. So that's a pretty big range in time for completing the program, but parents typically don't move on to the next module until they feel comfortable with the content. So we try to make it so the families feel confident with the skills that they're learning before moving on to the next topic. During a coaching session, like I mentioned, there is a pre-coaching component where the parent completes both the online tutorial and the quiz. And then we do have some of these recording charts for parents to record behaviors they may be noticing, or they can record information about how some of these skills are implemented at home in between sessions. During the coaching session, the coach will then go through the tutorial information. They'll answer any questions that the parent maybe has about the quiz. And then there's a chance to talk about some of these behaviors or teaching opportunities that took place over the week. During the trainings or during the coaching session, the coach will then observe the parent implementing the skills that they learned with their own child, and then the coach is there to provide guidance and feedback. This is a fairly long video. It's about 20 minutes and shows an Oasis parent training session in from start to finish, so you can see what it looks like. This is an online session with the coach working virtually with the family using this distance model. So I'm not sure if these slides get shared out eventually after the webinar tonight, but if you want to see what this looks like, you have a chance to watch one of these coaching sessions in action. This is just some of the data that we've collected over the effectiveness of this training program. These are some of the parent pre and post test improvements by the cohort. So you can see in the blue here before training, and then orange are after training data on some of the skills and knowledge checks that the parents take following the completion of the program. We also have some data here that shows satisfaction with the program. So this is using a 1 to 5 Likert scale, of 5 being that this is the best, no improvements, 4 being really pretty good. And so overall across the board, parents are pretty content with the training, both with online and the telemed sessions. Child outcomes, this is some of the data that we've collected over a couple of different behaviors, one of them being child compliance with the parent's request, and also just like vocals that may interfere with like a classroom setting. So compared to baseline, during both the post-test and follow-up sessions show favorable outcomes for the child. So to register for Oasis Parent Training, you can visit our website, which is oasis.ku.edu. At the top here, we have a tab that's called Find a Trainer. I do put a little asterisk here because we are actually in the process of updating our website. So the URL isn't going to change, but the layout will look fairly different, but the process of signing up should stay the same. Under the Find the Trainer section of the website, we have a list of all of our registered Oasis coaches. They list where they're located, there's contact information, and ways that they offer the training, whether it's in person, in home, or in clinic, or completely telemed, and then whether like translation services are available or not. So once you find a coach that looks like it fits your family's needs, you can reach out to them and see if they're accepting new clients. Once a coach has been contacted and can work with your family, then you will then register for training by clicking the registration tab on our website to fill out the registration survey. That sends your information to our team and starts the process of getting the training up and running. We do have OASIS coaches available all over the world. We are found in 9 different countries and 20 states. Coaches go through about 10 hours of asynchronous pre-training that they complete online, and then take 3 days of training with us at KU Med, where they learn to be a coach and implement this program with the families to fidelity. Some of our other training programs we offer include what Renee mentioned earlier, one of our direct service provider trainings. This is a training that meets the credentialing requirements for the intensive individual support provider and the registered behavioral technician credentials. And then for people who have typically like graduate degrees in ABA, we offer behavior specialist training for behavioral consultants. This also meets the Kansas Autism Specialist requirements. If you offer ABA to families, you can become an OASIS coach and provide parent training to your families that you serve. And then we do also have a train the trainer model where you can learn to train your staff to become OASIS parent trainers. If you have any questions about OASIS training or anything else that we have mentioned as far as resources, tonight we have our contact information here and as well as our websites. We do have a newsletter that we send out monthly where you can also get updates and information about services and trainings that we are offering. So we are happy to take any questions.
If you have questions, you can put them in the chat or turn off your mic or unmute yourself and ask them. If you are on Facebook, feel free to put them into the comment section and we'll get them asked. But I do have a few for you already around OASIS. And actually this question is for either of you because it's for both the Family Support Center and OASIS, but how would somebody refer a family to you?
We can use our website for that referral. So they would just go to the oasis.ku.edu link and then find the coach that works for their family, followed by the registration link. So find that slide and put that information up there again.
Okay. How do they know if their child qualifies for OASIS?
As long as they have a diagnosis of autism or other behavioral support need, they can go through the program.
Okay. And for just all the services at Kansas Family Support Center, how do I know that my child qualifies? You mentioned both if there's child services involved and possibly foster care, and then other families. So I'm just trying to better understand how we know what is best, best reason to refer them to Kansas Family Support Center.
Sure. Reneem, you want to?
Of course. So in terms of referrals, like our tier 1 service, it just focuses on giving parents more skills or more knowledge that they may not know of. And so, or it could be like knowledge that they know. It's just something that they can build onto, that they can utilize in their day-to-day activities. So that's what we do in terms of tier 1. And so we don't like work specifically with the child. We work directly with the caregiver or parent. And that could be either a foster parent or a caregiver, or it could be like a biological parent. But in terms of like tier 3 or tier 2, I believe Kelly has answered that and showed the like the way to do it online. But I know like in tier one, we focus strictly on caregivers and families.
So anybody can pretty much sign up and attend
Yes,
these.
of
Okay.
course. And that's why we offer like a blend of sessions. We have like an echo like in case someone has a professional background, or it could be a webinar in case someone is coming from like a caregiver background.
Okay. Um, Kelly, you mentioned Oasis has coaches in several states and in other countries. So families don't have to be from Kansas to participate in Oasis, correct?
Right. For qualifying for the program through the Kansas Family Support Center, they do need to be a resident of Kansas. But families outside of Kansas can participate, and we can bill through like their insurance.
Okay. Okay. I'm not seeing any questions on Facebook or in the chat. Does anybody have any questions?
If anyone does have any questions regarding KFSC or Kansas Family Support Center, please feel free to reach out to us at kfsc.ku.edu, or like that's our website, or KFSC at our like Gmail or Outlook. Let me pull it up.
KUMC.
KUMC, thank you. I'm getting it mixed up. We can send, will we like just send out our handouts?
It's on the handouts. Everybody who registered tonight received the handouts, so that contact information is on the
Yes.
handout.
So yes, their contact information is on the handout.
Okay. I'm trying to think if there's any more questions. Oh, is there an age range, starting age limit?
Any child can participate.
Yeah.
But any child, like for Oasis, up to what,
18.
21, 18? Okay.
18. Yep.
Yeah.
And then if families have older, like 23-year-olds, are they able to get support through the Kansas Family Support Center, or is it just 18?
So
Um,
it's designed for up to 18, but like families are more than welcome to attend. And if any of our material can like help them in any way, shape, or form, like that would be great. But we can refer them if it's for anyone that's above the age of 18.
Okay. And I think the last question I would have for you is if you are interested, I know that you have a lot of upcoming webinars and echoes, so I'm sure you are looking for presenters and speakers. So if somebody saw this and wanted to present or speak on a webinar, what would they need to do?
So we have a registration, or they can just send us an email directly at kfsc@kumc.edu and just let us know that they're interested, and I will reach back to them.
Okay, great. I still do not see, okay. Oh, those were just comments to the questions. Okay. Well, I don't see anything else. So I appreciate y'all's time tonight, and thanks for sharing information about this new program and support center for families across the state of Kansas. It's nice to know that we actually have a place for families to come and get resources and directed to some additional resources and support. So thank
Yes,
you,
of
ladies,
course.
for coming.
Thank you for having us. This is great. And I appreciate you taking the time for us tonight. And thank you everyone for watching and attending. I appreciate it. And hopefully we'll see you at our upcoming webinars or echoes.
Yes, and for those of you who may not have registered or did not get any handouts or watching this later on YouTube, you can email kfsc@kumc.edu, and they'll get you those handouts and any other information for you. So thanks everyone for joining us tonight. We appreciate you.
Thank you.
Have a good evening.
Thank you. Bye-bye.